We are now live, Chair.
Okay, hello everyone. Welcome to this evening's meeting of the Local Development Plan Advisory Committee. Tonight we'll be discussing issues relating to health infrastructure in Ealing, and we'll also be talking about the concept of 15-minute neighbourhoods, which is very much related to sort of the idea of promoting health and well-being in the borough. We've got three speakers who are going to be talking to us. But before then, there's some business of the meeting to get out of the way. So let's do that first. Apologies for absence. Well, I've had an apology from Councillor Sumner for he'll have to leave the meeting early. Apart from that, does anyone know of any other apologies? I haven't been notified of any.
I haven't received any, Chair, but I note that Councillor Shaw is not in attendance as yet, but he may well turn up shortly. Okay,
yeah, he may turn up, so let's see. Okay, urgent matters. I haven't been notified of any urgent matters. Declarations of interest. Well, do any members want to declare an interest they think is relevant at this point?
Paul, it's Linda.
Linda, go ahead.
Just to say, I'm non-exec director at Hillingdon Hospital. It might be relevant, but.
Okay. Well, thanks very much, Councillor Burke. Anyway, right. If no one else wants to declare any interest, matters to be considered in private. Well, there aren't any of those either. So minutes of the last meeting. This is the meeting held on 22nd February, and those are in the information pack. Does anyone want to raise any matters on the minutes?
No, happy to agree those, Chair.
Okay. Anyone else? Is everyone else happy to agree, or does anyone have any points they want to raise?
I'm agreed, Chair. That's true.
Okay. Well, those minutes are now agreed then. So on to the business of the meeting. So the first speaker we have is Polly Turton. I believe Polly is in attendance, who's from Arup, and is going to talk to us about the local health plan, or the local plan health study work that they've done. So, Polly, if you could just briefly introduce yourself and then start your presentation. It's over to you.
Thank you, Councillor Conlon. I'm just going to share my screen and see if that works to start with. Can you see a big blue PowerPoint slide on your screens?
No, I can't.
Okay, let me try. Maybe if I move it. Okay, how's that?
Yes, yeah, I can see it now. Yep.
Okay, great. Okay, well, good evening, everybody. My name's Polly Turton. I'm an environmental and health consultant at Arup, and I'm the project manager for the Ealing Local Plan Health Study, working with my colleague Anna Richards, who's the project director, and my other colleague Susanna Kupsikova, who have joined this evening's meeting. And our main client team at Ealing are Ilias Jubilee and Sam Cuthbert. So I'm going to give you a brief overview in the next 10-15 minutes of what we've been doing on the local plan health study, and hope to be able to have a bit of a discussion at the end. But if anybody has any queries as I talk through the slides, please feel free to raise a hand, and perhaps Councillor Conlon or Katie can help direct me to those questions, as I don't think I can see them as I'm presenting. So the context for this presentation then are, without kind of telling you things you already know, the council's priorities are creating good jobs, tackling the climate crisis and fighting inequality. And all 9 of the supporting aims for those 3 priorities can be considered relevant to the health study. And of a particular relevance is the supporting aim of healthy lives, which is also one of the 3 emerging themes for Ealing's new local plan. So in response to these priorities, we're working very closely with Ealing and its NHS partners to embed health and wellbeing evidence into local planning and development policies, with the aim of improving health and wellbeing outcomes and reducing health inequalities across the borough. So we're using a range of methods, including a stakeholder workshop and an online survey earlier this year, as well as a comprehensive analysis of baseline data and relevant policies and strategies. We've identified a range of local health and wellbeing priorities for Ealing as a whole borough, but I think most importantly, from a spatial planning perspective, we've also identified what the health and wellbeing priorities are for the 7 neighbourhood areas within Ealing, namely Acton, Ealing, Greenford, Hanwell, Northolt, Perivale and Southall. So we're now in the process of translating these health priorities into tangible policy recommendations for the new local plan, as well as other relevant strategies. And that is informed by an assessment of the future growth and demand for health assets, health infrastructure and health services in the borough, and a review of best practice case studies, which might provide some inspiration or precedent for what Ealing chooses to do next. So just to give you a bit of a sense of the approach we're taking, this concentric circle diagram is fairly well known in public health circles. It illustrates the determinants of health and wellbeing in our neighbourhoods. And so Arup, working with Ealing and the NHS partners, are very much looking at all of these determinants of health. And the blue diagram on the right is taken from a local government association manual about health in all policies. And it highlights the proportion or the contribution that various determinants of health make to people's health. So I've quite crudely provided an indication using the red stars of which of those determinants the local plan could have some impact on, and it's about 55% if you add up the various percentages. So that's through the kind of priorities and themes that the local plan covers. So based on this approach and our analysis so far, we now have a pretty good understanding of all of these things in relation to Ealing and its neighbourhood areas. So the wider determinants of health, so they are all of the factors which impact on our health and wellbeing. Health assets, which is any resource which enhances the ability of people to be healthy. Health infrastructure, which are the things which support the NHS's delivery of health services and healthcare. Health services themselves, which are perhaps sort of self-explanatory. And then perhaps most importantly, we are looking at, we now have an understanding of the health inequalities within Ealing and its neighbourhood areas. So these are the differences in people's opportunities to live healthy lives. And then linked to that is what are the health outcomes in Ealing and its neighbourhood areas, and what can the local plan do to improve those outcomes. This slide is a very high level summary then of our analysis. In a nutshell, there is considerable spatial variation in how Ealing performs against a range of health determinants and health outcomes. And this is apparent in the distribution, quantity and quality of health assets, infrastructure and services across the 7 neighbourhood areas. Acton, Northolt and Southall neighbourhood areas are the most deprived overall, which means that they are relatively highly deprived in a number of indicators across 7 themes covering a range of health determinants and health outcomes. But it's not quite as simple as that, because as you will all know, there are areas of very low deprivation in Acton and pockets of relatively high deprivation in the sort of more affluent, relatively speaking, neighbourhood areas of Ealing, Greenford, Hanwell and Perivale. Just moving on then to sort of future demand for health infrastructure and health assets in Ealing, using the GLA's housing-led projections, which look at sort of past and future housing need as well as demographic trends. The areas of Acton and Southall are likely to see the greatest population increase. And then if you add on to that the level of affordable housing need across Ealing, you can start to think about where the most housing is needed and what kind of housing is needed in those areas. The North West London CCG already knows that there are capacity issues with the existing NHS health estate in Ealing and Southall. And so our starting point then is that these neighbourhood areas highlighted in bold are the ones which have most room for improvement in terms of health outcomes. So if you were going to invest any kind of money or resources into anywhere in Ealing, it would be those ones to start with. Just to show that we are looking at the wards within the neighbourhood areas, this map just highlights those. And I just wanted to show you spatially what the data is showing us. So this map here shows the overall levels of deprivation, the darker colours being the most deprived. And you can see that corresponds with sort of south west Acton, east Southall and sort of southeast Northolt. And then if you break that down into, you see I've highlighted health deprivation and disability in bold and living environment in bold, as they are 2 of the 7 domains which comprise this multiple index of deprivation. So if I show you the map now just for living environment, you can see that actually Ealing doesn't perform that well in terms of the living environment indicators, which covers quality of housing, air quality and road traffic. I would suggest that this is probably due to primarily air quality issues in the borough, because there are bigger differences in quality of housing across the borough, which this map doesn't sort of depict. And then this map here shows the other domain of the overall deprivation index, which is specifically about health and disability deprivation. So this measures the risk of premature death and reduced quality of life through poor physical or mental health. And as you can see, this isn't quite as dark as the overall deprivation level, or indeed the living environment deprivation, but the patterns are generally the same. So darker colours in southwest Acton, bits of Southall and Northolt. And I think that the sort of takeaway message is it's not as simple as one neighbourhood area being more deprived overall or to do with living environment or health and disability than another. There are pockets distributed across Ealing and the neighbourhood areas. So that's the spatial picture. In terms of how we're summarising these priorities, I've just given you an example on this slide of how we are summarising the data for Acton, and we are doing something similar for the other 6 neighbourhood areas. And this slide here shows how we are summarising the information in more of a matrix format. So again, just looking at Acton as the example, where there is data which is particularly high or above the average, relatively speaking, we are indicating that with an X. And so you can see here, there's a red 3, which means that Acton has got 3 sort of key priority areas within housing and community, the housing and communities health determinant. So it's just another way of presenting the data and highlighting where the priorities for each neighbourhood area lie. So moving on then from the baseline data analysis and onto the sort of future growth and demand, we're working very closely with the NHS London Healthy Urban Development Unit on this project, and using, again, the GLA housing-led projections, they have produced this modelled data which shows ward by ward where the most demand or requirements for health infrastructure exists. So you'll see East Acton is a ward within the neighbourhood area of Acton, and due to the projected population growth there, quite a lot of primary care floor space is required, and indeed acute care. Although, as you might imagine, you can't have an acute care sort of facility in every ward. It just gives an indication of how many people from within that ward will need access to acute care. It's perhaps easier to get your head around the requirements for primary care, as that tends to be more locally provided within a given area. You can also see that Southall has fairly significant increases in population growth and associated increase in demand for health infrastructure, but not quite as high as Acton. So another key component of our health study is the development of a policy evaluation framework, and we're doing that for four main reasons. I've said three here, it's actually four. For reviewing and evaluating the extent to which the existing local plan contributes to health outcomes in Ealing, for testing the extent that any new policies could contribute to health outcomes as they're being developed and considered for the local plan, and then for establishing a longer term framework combined with relevant metrics for Ealing to monitor the effectiveness of adopted policies once the new local plan has been approved, and any future policies that may be developed afterwards. And then the fourth is to inform a bespoke health impact assessment framework for Ealing to use and require of developers for new developments in the borough. So I just wanted to give you a snapshot then of what the 12 policy objectives are within our health study policy evaluation framework. So they are broadly based on the wider determinants of health, which we looked at in that concentric circles diagram at the beginning. And what I've tried to just illustrate here is that each of these 12 policies has co-benefits with the other 11 policy objectives, and I've just used active travel and transport as an example. So for example, if you had a climate change related policy, you may have co-benefits with active travel and transport policies, is essentially what this is showing. And we've done this for all 12 policies just to kind of get a sense of where the biggest co-benefits might lie for your new local plan. And we've also looked backwards at your existing local plan. I've just given you a snapshot here of our assessment kind of conclusions of how well the existing local plan addressed active travel and transport as a policy objective. And as you can see, it's covered at a detailed level. There are about 18 policies, 5 SPDs within your local plan, which address that objective, and new transport infrastructure is considered a high priority for delivery in the IDP, the infrastructure delivery plan. Whereas looking at health as a policy objective, only 4 policies explicitly addressed health, and health infrastructure was given a medium priority for delivery. So this isn't a kind of a judgment on kind of the existing local plan. It's more, I think, an insight into where the strengths of the local plan lie and where the opportunities are for addressing health objectives more comprehensively. So based on all of this, we have some work in progress policy recommendations emerging. And I know Councillor Conlon's already referred to, the 20-minute neighbourhood or 15-minute neighbourhood policy vision. And I know Sophie Beagles will be covering that, so I won't dwell on this too much. But if there were to be an overarching 20-minute neighbourhood policy vision for Ealing, how could we tailor that to each neighbourhood area based on the particular characteristics of each of those areas? Perhaps a healthy spatial planning supplementary planning document would be a good idea to support that overarching vision. It could touch on all 12 of the policy objectives and focus on the health priorities for all of the neighbourhood areas. We think that some kind of policy requirement for planning and delivering new health infrastructure in line with projected growth for each neighbourhood area would be a good idea. The health impact assessment framework I mentioned earlier, as well as guidance for Ealing officers and relevant teams as to how to get the most out of it. Going to a sort of more human resources recommendation, perhaps some kind of healthy spatial planning and development officer could be a good idea, possibly sitting in planning or public health. And I think that then leads into the opportunities for linking the local plan with the Ealing Health and Wellbeing strategy, which is forthcoming, the revised one, and also the estates strategy for the North West London Healthcare Partnership integrated care system. So perhaps there's a new subgroup focusing on healthy spatial planning within that Ealing Health and Wellbeing strategy, or the NHS estate could be considered more of a health asset as just rather than just a kind of place for delivering clinical services. You may have come across health in all policies as an approach. So these are all policies, not just planning and development policies, to consider health and well-being. So perhaps the low-hanging fruit might be the other sort of two themes of the local plan. And then transport is a kind of obvious one, perhaps, with the active travel and transport policy objectives, co-benefits. And again, there might be some kind of health impact, health in all policies coordinator within Ealing Council, going beyond those planning and development policies. So very quickly then, this is just sort of highlighting that, for example, South Acton has quite high health deprivation, but potentially has many 20-minute neighbourhood features, which could benefit that kind of spatial approach to health and well-being. Whereas somewhere like Perivale has relatively low health deprivation, but compared to South Acton, arguably has fewer health assets within a 20-minute walk. So that could be worth exploring. And then, as well as having the sort of spatial vision and the policy ideas, how is Ealing going to deliver better health outcomes? So again, we've just put these out here as sort of work in progress suggestions, really. But one suggestion would be to increase the effectiveness of securing and spending Section 106 monies. I believe there are 7 active Section 106 funded health infrastructure sites in the borough. Could there be more? Perhaps more specific healthcare requirements into the updated IDP, and perhaps making it a high priority for delivery, as well as setting out clear guidance for specifications for what good health infrastructure looks like for Ealing. The NHS estate could be enhanced. You know, which of the sites within the borough would lend themselves most easily to sort of raising their local profile or community role. The one public estate approach and public interest test. So I know of one public estate project in Ealing, the Limes in Southall. Are there other eligible sites which meet that public interest test? Neha might touch on this in her presentation, but there is an existing sort of place-based partnership emerging within the North West London ICS area. But what opportunities are there for improving health infrastructure within the wider area, sort of perhaps outside of Ealing's boundaries, which could benefit Ealing residents? And then what about enhancing Ealing's assets, the green and blue spaces that you have? Could they be improved with multiple kind of co-benefits for health, and perhaps used for social prescribing for certain health conditions or health risks, you know, reducing those health risks for people in Ealing? And then I won't dwell on this one too much, but if anybody is interested in sort of precedents and good practice examples, we have reviewed a wide range and have identified the most relevant ones for Ealing. So we are working with Ilias and Sam to distill the kind of most kind of relevant points from those case studies to inform our recommendations. So I'll leave it there. Happy to answer any questions you may have. Councillor Ball's hand is up, but Councillor Connon, shall I leave it to you to yes, please. Okay, well, we'll have a chance at the end of the meeting to have sort of general discussion and questions to sort of all of the speakers. So at this stage, I'm just taking questions that are specific to, to Polly's presentation. So yes, can people sort of raise their hand, raise their sort of virtual hand if they can, if they can't try and attract my attention in any other way. And yes, I can see Councillor Ball's hand too. I can't see anyone else's hand. So, okay, Councillor Ball, can you ask your question, please? Go ahead.
Thank you, Chair. Yeah. So it was on sort of almost the last slide. There was a reference to spending Section 106 monies for health infrastructure. I mean, the problem that I've always heard when this is discussed is that the CCG won't accept new surgeries and whatnot because they can't afford the revenue costs. So although the council could spend Section 106 on the capital cost of it, or even a physical. It's in some cases it's not money. It's like a physical provision of a space within a new building. But the CCG won't be able to do it from a revenue basis. So is that correct? Firstly, and if so, is there some way around that?
Okay. Councillor Connon,
yes, Polly, please.
Another question?
Well, I can't see anyone raising their hand. So I think...
Paul, my hand's up. It's Linda.
Is it Linda? Oh, okay. Well, I can't see. Okay, Linda. Okay, you ask the question, then we'll take answers for both your question, then we'll take answers for both questions.
So one's not dissimilar to John's in that the biggest problem is usually workforce. So even if you get the space, etc. So what's your advice on how we take that into account? Where you'll know that there's a really hard pressed service area and that we're unlikely to get the workforce. And a second, slightly different question, and you might not know the answer to this, Polly, but we don't very often in planning really look at well-being in terms of, we might do a bit about green space, but it's all a little bit half-hearted, I think it's fair to say. And so again, from those good case studies, what would you be saying we should be doing at planning committee in terms of being serious about well-being?
Okay, great. Well, both of those are really good questions, which I've been thinking about today. So I'll start with Councillor Ball's question first. So yes, the short answer is yes. We've heard from our NHS partners on the health study that it's not sufficient to be given a space to kind of deliver health services in a new development. It needs to be the right kind of space with the right kind of rent, for example. So I think one of our emerging policy recommendations is going slightly beyond just a requirement for X meters squared of floor space, but kind of really sort of specifying what good looks like and what types of developments, what kind of is it ground floor, is it kind of is it a standalone kind of piece of estate, or is it in some kind of public sector building where rents perhaps could be lower. So I think we're kind of teasing out some of those barriers to yes, the CCG kind of feeling able and sort of equipped to kind of occupy those new spaces in new developments. There are, I think, a precedent is the we're looking at the ODPC, as you know, is developing their own local plan and have set out quite a kind of clear supplementary planning guidance about what they require from developers in terms of planning obligations and S106 monies, which we could sort of build upon for Ealing and sort of set out what good looks like, basically. Going back then to the question of workforce, yes, again, you know, I think there was a Royal College of Nursing report a couple of years ago which said, you know, approximately 50% of nurses spent most of their income on rent, and, you know, it was hard to keep people in London or attract them to London, particularly due to high living costs. So I think affordable housing for NHS staff, whilst is a bit of a challenge, could also be a real opportunity for the local plan if there was some kind of relationship between delivering that affordable housing and delivering health infrastructure. So I think the one public estate approach is something worth exploring there. And I think there's a scheme in Barnet where, yes, 100% affordable housing for NHS staff has been provided on surplus NHS land using the one public estate sort of model. So we'd be very happy to sort of explore that with our client team and NHS partners if there's a kind of desire to do so. And I think in terms of well-being, I mean, I think, you know, the World Health Organization's definition of health includes well-being. So I think what I hope this health study can demonstrate is that, you know, well-being is an essential component of health, and things like, you know, social prescribing for health using parks and green spaces is just as effective for, you know, for the majority of kind of health kind of conditions, obviously not clinical acute conditions, as, you know, a prescription to sort of pick up something from the pharmacy, or, you know, other kind of more sort of traditional health interventions, shall we say. So I think, you know, Ealing has such a kind of great resource in its green spaces and its canal and its river. So I think, you know, we could look into how the local plan could perhaps enhance and contribute to developing that as a real health asset for the borough.
Okay, thanks, thanks, Polly. Unless anyone else has an urgent question, then we'll move on to the next speaker. So, and that is Neha. I think you're from the CCG, so, you know, perhaps your presentation will you know, answer one or two of the questions that were just being discussed there. But over to you anyway to give your perspective on this issue.
Thank you. So just to introduce myself as a starter, I haven't been to this committee, but I know a number of people on this call, so very nice to come to this, and thank you for inviting me and letting me share from my perspective the health position from an estates perspective. My name is Neha Onakat. I'm the Borough Director for Ealing on behalf of, as part of North West London Clinical Commissioning Group. We're no longer a single Ealing Clinical Commissioning Group. We're part of North West London Clinical Commissioning Group. And just out of context, as of July, we will no longer be a clinical commissioning group. The clinical commissioning groups will be abolished, and in its place will be integrated care partnerships across the whole of North West London. And Ealing will be a place, will be a part of that. And we've been working up, and I'll just mention in some of the slides later on around our integrated care working. I'm just going to share my screen so my slides can come up. Just bear with me. Okay. So I hope you can see my slides.
Yes, I can see it. Yeah.
Fantastic. So just I haven't had much time to put some slides together, so apologies, but these are pulling together some of the most critical slides of what I wanted to share and talk to you, and hearing Polly has been really interesting and really encouraging for me, that we are working to the same agenda, and hopefully this piece of work will help us in the future from a health perspective. So in terms of the deprivation, I won't go into this in much detail. Polly's already covered this, but it's really important to align the deprivation with where the growth in population is happening and where the health needs are. As a bit of context, so I'm just giving our general practice premises estates in particular to start with, just some stats around that. And this was from a study that was done back in 2016. We're in the process of refreshing this study at the moment, because there has been a little bit of movement, although not significant amounts. So hopefully we'll be able to update this information shortly. But this just gives you a bit of a state of what's going on in our general practice estates in particular. So you can see a lot of our estates are quite old in the borough, and which won't be a surprise to any of you. And this pie chart here talks about the ownership. So 60% of our general practice premises are owned by the GPs themselves or a GP. 31% are privately owned by another type of provider, 1% with NHS Property Services, 2% with NHS Property Services, 3% trust owned, and CHP owned 4%. And our patient list sizes, so in comparison to a number of our neighbouring boroughs, we have some very, very large practices, but we have some, most of them are very small in terms of a list size for general practice. So we have some that are less than, or just over 1,000, between 1,000 and 2,000 patients registered, whereas some of our largest ones have around 15 to 17,000 patients. So you can see the range is quite significant. And you can see from this bar graph how much is leasehold and how much is freehold. So we did this baseline survey of 69 of our premises in Ealing. We've had a lot of funding over the last few years from what was first called the Primary Care Infrastructure Fund. It's now called ETTF, Ealing, Estates Technology and Transformation Fund, or something like that. I can never remember all of these acronyms myself. And we've applied for some of that funding to bring in new premises. And in fact, we've got one new premises opening over the next couple of weeks in Acton, actually in Acton Gardens, which is really fantastic because the premises those GP practices were in were really poor. But overall, the report and that report helped us generate, plans of where we could invest as money became available from NHS England. So capital money isn't available from local health provision. It sits with NHS England. So it's only when those capital monies are available across the country can we then apply and get a share of that funding in. And we're constantly working on schemes ready to put forward for that purposes. And the premises that are about to open in Acton Gardens is exactly one of those. But what this report showed us is that it's very aged. A lot of the premises is aged. It's non-compliant. A very small, small and medium-sized premises, and a lot of backlog of maintenance required. And in addition, what I would say is that we have had improvement grant funding, a few rounds of improvement grant funding since then. And compared to a lot of our neighbouring boroughs, so many of our practices have been successful in securing that improvement grant funding from NHS England, where they don't get 100% of the grant, but they get a good proportion of the grant. And that's helped us bring most of our premises at least to a compliant status. So this is the age profile of our estates. There's just a different way of cutting that data, but you can see 58 of the premises were built prior to 1961 and only 4 after 2000. So you can imagine what the estates was like. And then so we work in slightly different geographical areas to what the council does from a health perspective. So we have 3 localities, but we have 8 primary care networks rather than 7 sort of localities that you described, and neighbourhood areas that you would describe in the council. So, but if we split the borough roughly into sort of 3 localities, as we call them, and the localities are based around the GP practices working together. So our north locality, you can see the how many estates there were, just 11 estates, and the quality of the estates, none of them had an A rating, a lot of Bs and Cs and a small amount of Ds as well. And Acton, you can see 29 estates, Ealing and Acton, Central Ealing and Acton, and then Southall locality as well. So it gives you a bit of a picture of what's going on. This is the utilisation and of the clinical rooms. Everything is full to the brim, in effect. So that's the summary. It is absolutely full to the brim. This was done back in 2016. Right now we have very little void space, and what we do have is in 2 health centres in one side of the borough, and it is only admin suitable space. So we can't move any clinical services into there. And during COVID, it was a critical issue, because we needed to set up a COVID hub in general practice, and we had no room to put that in, and we had to our sexual health services vacated some space for us at Mattock Lane Health Centre in order for us to move back in. And then the sexual health services needed to come back, and we had no place to put the COVID community clinic back in again. So we had to go back around the drawing board and think about a new model of delivering COVID. So that's the impact not having any suitable estates will have on some of our delivery. And when I was saying, it's important to understand the deprivation, so we were seeing the maps earlier, and this is where, from our understanding from a few years ago, the population growth in particular is planned. And Southall is already a very a deprived area and already quite tight in terms of its space. And there is so much growth happening in Southall. However, Ealing Broadway, we've seen so much already. We have a huge development in the north of the borough, and Acton, and we talked about the Old Oak and Park Royal area as well. So we worked really closely with our council, trying to come up with our own plan of how are we going to deliver the health needs for the population that is moving into the borough. And this sort of gives you a bit of an idea. So the red dots were potential opportunities for development. The 106 is where a health centre was being offered, or 106 monies. HC is where there are potential opportunities for health centres to come up. And then initially we were thinking about 3 hubs in Ealing, which could then aggregate and deliver certain services collectively for a local population. All of the yellow dots around here are our GP practices as well, so you can see they're all spread out. So, and we have Jubilee Gardens and Grand Union Village very close to each other, and Featherstone Health Centre as well. So we have a few estates, but nothing is really empty. So we do look at all of the estates being offered to us and the Section 106 monies, and very often the estates that's being offered to us it's either if for example you've got a tower block and it's the whole of the ground floor that's being offered as a health space. Actually, a lot of that space, it hasn't got any natural light. So working all day in those premises as a health premises isn't going to be ideal. And the value and what we're being offered in terms of the ongoing rent or the fit out costs and everything are quite high and unaffordable for us. So we have to really think about which estates we need to progress and how quickly to progress them. We have been moving with a few of them. However, because of COVID, they've been delayed. I'm really glad that Acton Gardens is moving forward, but we have significant growth that's happened in Ealing, in central Ealing, and we've had practices who have almost fallen over, and they've had to bring in their own private developers to help come up with a model that would be affordable. The development in this area has been delayed by a few years, so population is moving in, but there is no capacity in local general practice to deliver the care for them. So it's a real pressured area. And then in Southall, with the amount of development happening, we have so many small practices that we need to consolidate and bring one or two premises forward, which are affordable, but then bring our community services and mental health services, as well as some of our general practices who might want to move in together. So we have processes to go through to choose who to move in. And this sort of gives you a bit of our planning work that we were looking at before. And obviously we have to look at Ealing Hospital as a site as well to help us with the pressure that we might be facing. And then this slide just gives you a bit of an update as to where we've got to. The Ealing East Hub, there was a delay. We were talking about Acton Health Centre and whether that could be redeveloped, and there's been lots of conversations happening between estates departments around Acton and what would the future look like. And that decision has been delayed, and that has again resulted in significant pressure to practices and the health centre, and where practices leases are coming up, they don't have anywhere to go to. So they are really, we sometimes have some very pressured timelines and have to come up with unique solutions. So we do need good estate solutions going forward. And with Ealing North Hub, I talked about it already. We actually ran a process of expressions of interest for practices that would potentially want to move into the Ealing North Hub, but due to COVID, everything got delayed, and now it's delayed by quite a few years, and therefore there is that increased pressure in that area. Just for information, we have a whole process set out about how we would choose practice and who, an expression of interest process, and the process of then arranging and just working out who wants to move and therefore how much space you actually need in comparison to the growth in the local population, etc. So it's quite a complex set of decisions. So I won't go into that one. Grand Union Village and Jubilee Gardens, where I was talking about, there is void space, but it's only administrative space, and they're both in one part of the borough, which I showed you earlier, towards the Southall end of the borough. So it's not a solution for the rest of the borough anyway, and it doesn't have any clinical capacity either. And then the Southall development, we've been looking at, which option in terms of estates we would need to talk to the developer and continue the conversations on with the developer. So we are having those conversations with them, but it is again taking a long time. The space originally identified it just wouldn't have met the requirements that health premises need. And the other thing to note is that we had to do a detailed piece of work, and we actually brought in some support to do that piece of work around Southall, to talk to all of the local practices that might want to relocate, look at the growth in population, and then work out how much space we would actually need, and then have those conversations with the developer as to actually what are they offering us, what are the options on the table that we could consider. But we also can't have too many estates, because otherwise we end up with empty estates and it's not value for money, and we can't have and we need to take into account this new way of working with some access of digital delivery now, which might mean that you need to change how you use your space and what you actually need. Just as a little bit of context, I'll be very quick on this, but we are starting to work really closely with all of our partners as part of our local place-based partnership. And we work really closely with West London NHS Trust, who provide the mental health services as well as community services in the community. London North West Hospital Trust, which runs Ealing Hospital. Our GP Federation, which is all of our GP practices are a part of. As part of North West London CCG, we work really closely with them. We link in, obviously, with our council colleagues. We work really well with our council colleagues and the voluntary sector. But our patients go everywhere. So our patients, because we're right in the middle of North West London, they also flow to Imperial, and they flow to Hillingdon Hospital, and they flow to Chelsea and Westminster. So we try and include all of our partners. So we're working really closely together to have a plan that's comes together. And this is our approach to working and really trying to improve outcomes. And workforce, and interesting you brought up workforce. Workforce is one of the areas that we are looking at, is how do we attract and retain our workforce in Ealing, and having affordable housing, but also good premises in which to work that isn't that is enticing and is welcoming, is also as important. I won't go into this, but this just sort of describes how we operate as a partnership, or how we're trying to organise services, shall I say, rather than operate as a partnership. But we have our practices who work as a group of primary care networks. There are certain services that you can't have. We've got 8 primary care networks. You can't have, say, 8 specialist diabetes nurses, but you can have 3. So you would organise that in 3. And then as an integrated care partnership, we work really closely together. And one of the important things, and the reason for putting this final slide in here, is because of how we are starting to think about our future ways of working as integrated network teams. They would need to have good estates from which to operate and work together to see the population. So that's where the One Public Estate strategy, but also how we use our existing estate differently, is so critical. And that was all I was going to talk through. Happy to take any questions, and sorry, such a quick canter through.
Okay, that's great. Great, thanks. There's obviously, it seems like quite a bit still to be done to identify, you know, how we're going to meet all of the increased, you know, demand for healthcare, especially in Southall, it seems, but well, unsurprisingly, but also in other parts of the borough. So does anyone have any questions specifically to Neha? So again, I'm looking for, oh yes, I can see several hands going up. Okay, well, I've got Councillor Woodruff, Councillor Mahmood, and Councillor Shaw. So I'll take them in that order. So Councillor Woodruff, go first, please.
Yeah, thank you for that. That was very interesting. I'm a councillor in Greenford Green, so I know about the Greenford Quay development, and people still talk quite a lot about the what's going to happen with the health centre and hub. So it occurs that, I mean, I'm on the planning committee. Quite often planning applications come forward, and if it's a large development, are usually objectors who are saying, well, I'm not sure the health people can cope with all this, and I'm not sure that we really get a proper answer about that. So when there's a big development, I mean, I suppose how much do you raise an objection? How much do you sort of say, well, I'm not sure we can really cope with this big development? I think that's probably something that maybe we on planning committee haven't really thought enough about.
Okay, thanks. Thanks, Simon. I think I'll just take Councillor Mahmood's question next, and then I've also got Councillor Shaw and Councillor Manro. So I think I'll take Councillor Mahmood, then we'll answer those 2, and then I'll take the next 2 questions. So go ahead, Tariq.
Thank you, Chair. And so it's almost the more or less the same question as Councillor Woodruff was asking in terms of west side of the borough, where we are having a dense population like Greenford Quay, where we are thinking about 3,200 unit roughly. And we have got another project is going on, Kellogg's Tower, like you rightly mentioned that, Naha, the other side of so we're talking about altogether 5,000 unit. And if you see the national average, so we are talking about if 2% in one unit, we are talking about additional 8,000 or 9,000 new people in the area. And I could see there's only two surgeries are there, or 3 surgeries, especially the Greenford Quay is really will be the very critical dense population there. So what's your mechanism? How you would start working in terms of it is related to the population, or how many units are coming, how many new peoples are coming in the area? So how you could work? I just want to understand that in terms of health facilities. Thank you.
Okay, thanks, Tarek. Okay, Neha, if you've got those 2 questions, can you have a go at answering those?
Sure, absolutely. So I'll be honest with you, Councillor Woodruff. We don't usually hear about the plans in the development until it's quite late down the line, and the plans are already in motion, and the developers are in and starting to work through what that would look like. And it would be really sensible, and that's one of the things I've been trying to do, is create a really good working relationship with the council teams, and that's why this integrated way of working and creating those relationships is so important, to get that pipeline and understand what the growth is going to be. So it's not for us to say that, you know, we don't think this development should happen or anything like that, but we do need to make sure that we can keep up and cope with the growth that is being planned. One of the biggest pressures has been is workforce. It's not only estates, and estates is a big one, but workforce, as Councillor Burke mentioned earlier, is a really critical issue at the moment, and that's not just for us in Ealing, that's everywhere. So we have a number of schemes in place trying to attract new workforce and different types of workforce to the borough, and then try and find ways of making sure that we can retain them and giving them opportunities within Ealing. And as working as part of North West London, I'm hoping that will give us more of an opportunity to think wider and get more support and funding to some of our more local schemes. That it only affects Ealing, these large developments, but actually there will be a North West London wide implication on hospital services, on mental health services, on community services. So working as part of a North West London wide system, I'm hoping will help come up with solutions. But I'm not going to pretend that it's not tough dealing with that, but we've got to make the best and try and cope the best way we can. And then the whole question about Greenford and our processes. So we have a strategic estates team within North West London. We also work really closely with NHS England as well, and their estate and London-wide estates team as well. And we have a number of, so money comes in to the NHS from a capital perspective. There are not only schemes in Ealing, but there's countrywide schemes bidding for the same money in effect. So doing everything we can to be as proactive as possible in planning, thinking through what we need, how we need, where we need it, getting to a really good state to then, as soon as national monies become available, we are applying for them, is one of the critical things that we do and we have to continue doing. There are some local schemes. So, for example, if there is a practice who has an opportunity to develop their premises and there's going to be growth in that area, and we've got Section 106 monies, we will put a process in place to work with the council to get that 106 monies secured for that premises, and then make sure that that work is followed through, working really closely with the practice. I mean, some of these premises are owned by the practices, so it's not always as simple as just giving them the money because that's what they think they can do. It has to be based on the needs of the local population as well. So if there is growth, that's where the priorities will be. I hope that helps a little bit.
Okay, thanks. Right, well, I've got another two councillors. So Councillor Shaw and then Councillor Manro. Councillor Shaw.
Yeah, thanks, Chair. I think you've sort of partly answered the question that I had, thanks, Nia. But it was more about the control of the estates and development, if you like. And, you know, in what you've presented, you're showing us, you know, sort of developments where you're trying to take pieces of it, perhaps, to further the NHS estates. You know, and really I'm sort of wondering what sort of control you have over that, where it is just in a development. So do you have effectively developers dictating to you what the space is like, that this is what you're going to get and you need to try and fit the services into it? Or, you know, is there some sort of say with you, you know, because obviously because of the nature of some of the services that are needed, you might need some quite unique spaces and an internal works in there to make sure that it's usable. So, you know, I'm particularly interested in just how you can get it to work, because otherwise we can end up with lots of developments without places within the developments that have happened to grow the NHS estate, which is a bit sort of nonsensical. And similarly, from another perspective, you know, where you're talking about the GP practices, where they are owned, you know, by, you know, perhaps privately owned or whatever, and you're securing Section 106 money, then how much say or control would you have in the development of what's needed there? So, you know, if Section 106 money is secured and someone says, oh, well, what we'll do is we'll put this onto the back of our property because we've got space there to do it, just, you know, whether that would meet the needs or not. Or, you know, could you still end up with things that aren't really fit for purpose? So really, you know, what sort of control would you have as the CCG, if you like, in actually developing the spaces that you need?
Okay, thanks, Gareth. Councillor Manro.
Actually, Gareth, I'm going to follow on really with yours, but maybe from a different context. I'm looking at it in terms of policy, and as part of the local plan and our sort of look at how we help the health service deliver for our residents. Is there a process where you would outline what you would need in a premises, i.e. the light, you talked about daylight, sunlight, and the kind of rooms you need? Is there a model premises that our planners have so that they know that if we're going to offer you a site somewhere, that it needs to meet these basic minimum standards in terms of light, daylight, the type room sizes, etc. Do you have a generic one which sits with our planners so they know what they can talk to the developer about in terms of actually then providing a space that Gareth was saying is fit for purpose for your needs?
Okay, thanks, Chantal. Okay, Niha, there's sort of quite overlapping questions there. If perhaps you could have a go at answering them.
Quite a few questions within those two questions, so I will try and address them all. And I'll start with the last one first, actually, because for me that was the easier one, because I'm not the technical expert in these areas at all. So we totally rely on our technical estates strategic team. But my understanding is there are lots of national guides and policies about what would be required, what would be sensible or not. And my understanding is they would be a part of the conversations. Definitely, and this sort of leads on to the next question about the conversation with the developer when they're offering us premises. We wouldn't just accept whatever they give us just because that's what's available. If something wasn't suitable, we would need to go back to the drawing board, absolutely explore everything with the developer of what is available on the premises, on the site, and Southall is an example of that, and so is the Greenford site. We were offered one premises first. We said, actually, that's just not going to fit the needs, and this is why. The developer went away, had a conversation, said, actually, there's this other opportunity. How about this one? Does this meet the needs? This is what you said you needed, etc. So there is a bit of negotiation and conversation that happens. Sometimes we don't always get what we need, and they can't offer what we need. So turning that into monies is helpful, but sometimes that money doesn't go very far, to be honest. But what we always do is look at an options appraisal and develop an options appraisal about all of the various potential options that might be available, not only with that developer, but surrounding premises that might be in the area as well. And are there other ways of delivering the same outcome, but using another premises instead? So all of these things take a long time, and that's why it's, we haven't moved very far in terms of securing estates, and that's why we are pressured in Ealing in particular. I've raised this as a risk across Northwest London, and I do at every single stage I can about how pressured the space is in Ealing, and the demands and the needs and the changing requirements are just growing all the time. And in terms of the Section 106 monies, or somebody developing something in general practice or one of our provider trusts, there is a whole process that they would need to go through. They can't just make that decision on their own. It would have to be an approval process, because only then would we agree to then release any funding to them. So it's only if it meets the needs of our population, because there is an ongoing revenue implication for us. So we have to make sure that whatever we invest capital-wise doesn't turn into something we can't afford going forward. I think I've answered all the questions.
Okay. Yeah, I think so. Okay, thanks very much. So please stay around. Of course, there may be some more questions at the end, but for now, let's move on to the third presentation. So that's Sophie. I think you're in the regeneration team, aren't you, Sophie? And okay, so over to you to tell us about, is it 15-minute neighbourhoods or 20 minutes, whatever the current number of minutes is, so, but whatever. So.
Thank you, Chair. Yeah, we're going to stick with 20-minute neighbourhoods. I will just try to share my screen. Please bear with me. Has that come up?
Yes, I can see the screen. Yeah.
And is that an okay size for everyone?
I think it is, yes. Yeah, for me it is.
Yeah, I can see that fine. Thanks, Sophie.
Great. Okay. Well, yeah, I'm Sophie Beagles. I'm a Principal Regeneration Officer in the Area Regeneration Team at Ealing Council. Our team sits within the Economic Growth Service alongside colleagues working on the local plan. And I'm going to talk a bit about the 20-minute neighbourhood model. I think this follows on quite nicely from the first presentation when we sort of briefly touched on this. I've got sort of 10 slides to talk through, and yeah, just sort of a breakdown on this slide here. So I'll kick off with a quick intro to the 20-minute neighbourhood model and what we really mean by that. I'll then jump into sort of why we're considering this model and the key benefits, particularly in terms of health outcomes. I'm then going to touch on some of the local and regional data that is supporting this approach. And then I'm going to talk about some of our emerging work in terms of how this model could play out across Ealing's 7 towns, and how this all links back to the local plan process. So this first slide gives a really high level overview of the 20-minute neighbourhood model. The clue's really in the name, but the basic idea is that we should be creating thriving local neighbourhoods where employment opportunities, services and amenities are all within walking distance of our homes, and ideally within a 20-minute walk, to be specific. But it does go by other names, 15-minute neighbourhoods, as well as one that you might have heard of. But essentially the model is looking really at the provision of services and opportunities, as well as ensuring that these are accessible, with a real emphasis on using active and sustainable travel modes to meet your everyday needs. This diagram on the right just starts to illustrate some of the ingredients of a 20-minute neighbourhood. And this is sort of a framework, and we'll get on to how we're tailoring this to each of the 7 towns a bit later on. But essentially, this is covering everything from retail uses, leisure, health facilities, employment spaces, community uses, green spaces, a real whole mix of different uses. And I think the kind of important thing to flag early on is that although this model is obviously based on sort of localism and provision of services locally, we are also recognising the importance of being able to access wider and less local opportunities, and the benefits that can bring to Ealing residents. But it's also important to recognise that as a borough, we need to continue to grow and support our visitor economy. We know that some parts of our borough are really reliant on visitors to the area. So it's very much a balance between having a really strong and good range of different local uses, combined with that connectivity to wider uses and that opportunity to bring a wider audience into Ealing. So this slide just summarises some of the sort of guidance and emerging policy that is sort of supporting this idea. The 20-minute neighbourhood model is something that we set out to do in our plan for good jobs. So we set out the commitment to radically reimagine our town centres and other commercial areas as part of vibrant 20-minute neighbourhoods. It's also something that features in the Mayor of London's COVID-19 recovery programme, which really recognises the potential of the 20-minute neighbourhood model in terms of enabling a strong recovery from the pandemic. And there's lots of emerging guidance out there, including guidance from the Town and Country Planning Association, as well as many others. This next slide just starts to map out some of the key outcomes and benefits of the model, and how this can really deliver against council priorities. So some of the health outcomes listed here are really linked to the fact that this model aims to support increased levels of active travel and aims to get people cycling and walking through new, improved, safer and more attractive routes for walking and cycling, which in turn we'd hope would increase levels of physical activity, reduce pollution, improve road safety as well. And then we've got other outcomes that are more linked to the local provision of services, whether that's access to healthcare services or access to local space to grow healthy food. And I've also just included here some of the sort of wider benefits. I think really important to recognise that there are economic, environmental and social benefits too. and that really these kind of all overlap and intersect. So on the economic, the model is very much about supporting strong local economies, creating local jobs, supporting local businesses, and sort of tackling deprivation at a very local level. There's obvious environmental benefits in terms of reduced emissions, but also if we're making walking routes that are more attractive, greener, more attractive to use, we're also bringing some biodiversity benefits there as well. And then also on the social benefits, and again, there's lots of crossover with the health outcomes, but this model really aims to help build strong communities, reduce severance and isolation, which we've already heard about a little bit earlier in the meeting, and support sort of well-being more widely. This next slide unpacks some of those health outcomes. I've just pulled out some key data from various Transport for London studies that have looked into the potential health benefits of increasing levels of active travel. And really kind of some of the key findings are that sort of a lack of physical activity is currently one of the biggest threats to health across London. And that actually active travel is a really great way to enable people to meet those physical activity needs. It's something that can be easily incorporated into people's daily routine, for example. And just to put this into numbers, so one of these Transport for London studies identified the potential of 60,000 years of perfect health could be gained each year across London if we were to swap motorised modes for short journeys, and if we were to swap and walk or cycle those journeys instead. This can then be monetized as over 2 billion each year in terms of health economic benefits. And it's really kind of cross-cutting as well. There's been lots of research into the sort of health impacts that can be improved from both physical activity, improved air quality, improving accessibility and severance. So some really big potential for impact through this model. And I think over the past 2 years, the model has arguably become more relevant than ever. Over the last 2 years, I think we've all found a newfound appreciation and reliance on our local areas and local neighbourhoods. This graph on the right just shows how high streets in particular have really seen a resurgence during the course of the pandemic. So in orange, you've got footfall to local high streets in Ealing, and you can see that the dashed line is sort of pre-pandemic levels, but you can see that obviously there was variation as restrictions were put in place, but generally footfall did kind of get back to pre-pandemic levels, and in some cases exceeded pre-pandemic levels as people were spending more time locally. And it really wasn't the same picture if you look at sort of the central activity zone in central London. Footfall was much lower, and people just weren't using those facilities as much as they were the local high streets and centres. And the other thing to sort of highlight here is just the fact that these local centres and high streets also really account for a big portion of the economy, and it's really important that we're sort of protecting those uses. So across London, 28% of all jobs are in local high streets and town centres, and that equates to 41% of all businesses as well. TfL have already started preparing some initial mapping across London that looks purely at kind of physical distance to everyday needs. So I've just sort of zoomed in on Ealing in this map on the right. This is a bit of a heat map. So the areas in red are those that have, well, red to yellow really, are those that have the best accessibility to everyday services, which includes schools, GP surgeries, food shopping and open spaces. And then the grey areas are those where it's not accessible. And they're the areas that are currently sort of least suitable for 20-minute neighbourhood living. Now, obviously, this is purely looking at, you know, physical distance, and there's a lot of other factors at play. We do need to be looking into kind of the suitability and quality of services and opportunities. Although they might be within physical distance, they might not actually be serving that local community in the best way. And we also need to look at the kind of quality of accessibility as well. You know, it might be on paper a 20-minute walk, but on the ground, that walk might be you know, not the most attractive route to take, and local people might not be choosing to use active travel as a way to access those services. So there's a lot of kind of analysis to be done. But interestingly, you can see that we've got some areas across the borough, such as Hamwell, that are perhaps more suited currently to the 20-minute neighbourhood model, whereas areas like some parts of Northolt, some parts of Southall, Greenford and Perivale and Ealing as well, yeah, are kind of less suitable in their current state. This next slide overlays some of the deprivation data that we've already heard about earlier. So it just overlays some of that on top of that accessibility analysis. And what you can start to see is that some of those gaps in services also overlap with areas of high deprivation. So particularly for parts of Northolt, as well as parts of Southall. And they're in particular, it's in those areas where we need to be thinking about the 20-minute neighbourhood within the context of tackling deprivation and inequality. We're certainly not saying that this is a one-size-fits-all approach. This model is really a sort of flexible framework that can be used by local communities and placemakers. And as we've already touched on, you know, it's something to be tailored to each of Ealing's towns. What we're currently doing is piloting a community-led approach to developing these frameworks and really understanding from the local community what a 20-minute neighbourhood model would mean for them. So thinking back to those ingredients that I had on one of the earlier slides, you know, how might different communities prioritise these? Are there additional ingredients that perhaps are needed in one area and not another? So we're really kind of tapping into that local intelligence and empowering local people to have an opportunity in how change occurs across their area. On the right here, I've just pulled up some images from various engagement activity that we've been doing in Northolt through our Visions for Northolt programme. And we've been out and about for the sort of last year and longer, doing workshops and events in different locations and places to really gather that local perspective. This next slide just sort of sets out what these frameworks will include and some of the key themes. And I think kind of key thing to stress is that although our team is sort of coordinating this piece of work, very much working alongside other services and kind of pulling in findings and data from other pieces of work. But essentially the idea is that as we've said, these frameworks will be following a community vision that has been developed with local people. We'll then be doing some sort of research and an audit to see what uses are already here, what's missing, what's the accessibility like. And then we'll be sort of developing a bit of an action plan and framework for the area as a whole that looks at both sort of short and long-term interventions that might be needed, but also kind of hard and soft measures. So some of the things that are needed might be quite physical, like improving paving and cycle routes, and then other things might be slightly more soft measures. So it might be about supporting enterprise or offering training opportunities to make sure that local people can access those local job opportunities. And we'll be kind of looking at it at sort of an area-wide scale, but then zooming in on sort of specific areas and projects. And I think the kind of the delivery section at the end will sort of set out the tools and mechanisms that we'll use to bring some of these interventions forward. And planning policy certainly will be a big part of that. But this piece of work also has a wider role to play, and there are sort of different mechanisms we can use. For example, it might be applying for external funding and directly delivering a project, as we are doing with Northolt, where we've recently secured multi-million-pound funding to deliver active travel improvements. So there'll be a whole sort of host of recommendations that sort of come out of these frameworks. And they'll be covering a range of themes, which I've shown at the bottom here. So everything from movement through to job creation, placemaking, public spaces, space for social and cultural exchange, and so on. And then this final slide just sort of sets out where these frameworks will feed into the local plan. So these frameworks will specifically feed into the 7 town plans within the local plan. And as I've said, being coordinated by the area regeneration team, but very much a cross-service piece of work, and we'll be feeding in the findings that Polly's presented and that others are working on as well into these frameworks. So very much a joint piece of work. And that is it. An opportunity for anyone to ask any questions.
Okay, are there any questions specifically to Sophie on 20-minute neighbourhoods? And then, so first of all, questions just for Sophie, and then we'll move to questions that we can ask to sort of all of the participants. So, okay, I can't see any hands up. So if anyone does have a question. Okay, so shall we move to the general discussion then? Who wants to? So can all of the presenters please be ready to answer these questions? Does anyone have a question for the panel of 3 presenters? Okay, I can see Councillor Burke and Councillor Shaw. Okay, I'll take those 2 first. Linda, please go ahead, and then Gareth.
So it's really, for me, oh sorry, it's very dark. Sorry, I'll turn the screen. My question really is about how we really make sure with the ICS starting and with all the changes that are happening really, and the local plan, is how we make sure that these things are all joined up and that the local authorities and the public health has a really strong presence on ICS. And bluntly, you know, working in the acute sector, that they don't become just about the acute sectors, and that we really keep these kind of initiatives front and centre with the ICS and with, as I say, other changes that are taking place.
Okay, thanks, Linda. If people could just note that question, and then Councillor Shaw.
Yes, thanks, Chair. I mean, really, it's not too dissimilar to Linda's, but really coming from another position, which is, you know, obviously we're taking this to look at the local plan and how we can feed in better into the overall policies. And I suppose really it comes back to perhaps Polly's presentation and looking at sort of health policy and it being developed through all areas of the council, you know, and how that could fit, you know, within the council structures itself, which I know sort of some, you know, not everybody here may be able to answer, but just thinking, you know, how we can work that to make sure that it's embedded within sort of future and the local development plan, crucially, but that this has its knock-on effects, you know, right through the council and all council departments. I mean, Polly made an interesting suggestion, you know, of an officer, if you like, or you know, HR money being put aside and actually investment being put in there to make sure that coordination happens across the council. That, you know, as we all know, too often large bureaucracies, you know, tend to work in silos too much, despite the fact we all talk about cooperative working and how it works on a day-to-day basis. Very often that's missing. So, you know, really asking the people here about health, how they believe it could best be sort of ingrained. You know, I was interested in Polly's sort of best practice you know, analysis that she threw up, and delighted to see Hull City Council in there as my hometown. You know, and I do know some people on the council there who've been working in this area. So, you know, it's sort of looking at those perhaps and using them as benchmarks to see what can be achieved for Ealing. Okay, thanks, Gareth. Okay, Polly, if you can perhaps go first and have a go at answering those two questions, and then Ihan and Sophie can give their response.
Sure, I'll give it a go. So yeah, I think the key is sort of coordination and integration, because and I think there are emerging kind of opportunities. So the integrated care system and the sort of place-based partnerships model that the NHS now requires of its current CCGs, I think that provides a real opportunity. But I think, you know, there are so many partners involved that there's almost kind of some internal coordination and integration that's still needed. So I think perhaps that's where this idea of a kind of dedicated person or people to ensure that coordination and integration takes place, I think is really key, because clearly, you know, Neha, Sophie and I could get our heads together after this meeting and really kind of work to kind of integrate and combine the work we're all doing, and that would be a great result for Ealing. But I think there's still another step or two to be taken to make sure that actually gets you know, embedded into local plan policy and kind of rolled into kind of ongoing investment in healthcare estate in Ealing. So yes, and I think Hull City Council is a good example, but then closer to home you have the London Borough of Southwark, who really have embraced the health in all policies approach. And I don't know if you've been following, you know, local government developments recently, but their new local plan has recently been adopted and is published, and that was largely informed by greater integration between the public health team in Southwark and all the other council departments. So I think there are, you know, real and recent examples of how Ealing could take all of this forward and kind of make it a reality rather than just a sort of policy aspiration or a kind of piece of research.
Okay, thanks, Polly. Neha, do you have something to add to that?
Yeah, just to add, I think two things from myself. One was, and I'd like to get Anna to give her view with this as well, but as a place-based partnership over the last couple of years, we've really started to come together and have all of these conversations. So that joining up of vision and aims and what we're trying to do is really critical for all of this. So I really welcome the conversations actually today. And I think we're moving in the right direction, but we've got a lot more to do. But I really like the idea of all areas in the council thinking about health and making that part of their decision making. We've done, I've seen a lot of movement in the last few years. So for example, housing, when patients are being discharged from hospital, if they're living in premises that aren't great for them, how can we use some grant funding to get their housing situation sorted and adapted for the needs of the patient so they can come out of hospital. So, you know, they can do things at a very micro level with individuals, but you can do things at a very strategic level. So I think that place-based partnership is really important for the future. And I don't know what Anna thinks, because she's part of that.
Okay, I'll just take Sophie next if she's got any points of hers to add on that point. Yeah, go ahead, Sophie.
I mean, I don't really have too much further to add, and I think our team is sort of less specific and less focused on purely health. But I would just add that the area regeneration team is very much about breaking down those silos by taking an area-based approach. So very much about providing opportunity to coordinate projects across the council based on the areas that they're taking place. And I think these 20-minute neighbourhood frameworks are a really good sort of channel to do that. And I think actually the fact that they are a bit broader in scope and that we're not focusing just on health outcomes gives us that opportunity to look at how we can think about wider factors and wider opportunities to achieve health outcomes. So yeah, perhaps I'm kind of looking a bit more at the broader picture, but certainly opportunities to join up.
Okay, thanks, Sophie. Okay, well, I've got Anna Bryden has put her hand up now, and I've also got sort of Simon Woodruff. So I'm guessing, Anna, that you sort of want to perhaps respond to some of the points that were just discussed. So maybe you can do that. Then we can take Councillor Woodruff's question. And can other members please think of any questions they want to ask, or if they just want to make a general contribution at some points. So there's an opportunity to do that. Okay, Anna, go ahead, please.
Thank you, Chair. So for those who have not met, I'm Anna Bryden, Director of Public Health at the Council. I think really great questions about how to integrate all this fully. I think you'll see you've got colleagues like Polly and Sophie giving beautiful public health presentations. So I think you can see a lot of that work's already happening. We're not starting from scratch by any means at all in Ealing. Really good joint working across the council and with NHS partners like Neha and lots of others as well in the local trusts. A good example is some NHS work that's happening in South Southall. It's linked around the local primary care network, so the local GP practices, but we're involving people from across the council, Let's Go Southall, etc. So it is really looking at kind of, not just clinical care, but that local community as a whole. So there's really good examples going on. I think the question about how you integrate the health in all policies approach, how you do it well, how you do it without a lot of bureaucracy is a long-standing question. I think, like Polly said, there's some really good examples we can learn from in Ealing. Some places it really works to have it very transparent. It's a health and all policies approach. Everybody signs up to it. Other places you can do it a little bit by stealth. Don't even talk about the approach and just integrate things as much as you can, like Councillor Shaw was saying about embedding it. There's some really good tools out there. So like we have, say, equality impact assessments for some of our big strategies across the council. You can do the same with health impact assessments. You wouldn't necessarily do it for everything, but at least focus on those really big things you can change. But there's also a lot of work that goes in the background just by working across teams. So it'll definitely be great as part of this local plan work to see some of those really good case studies and see how they might work in Ealing. And also just looking at how we work already across the local council departments and other partners, because I think there's a lot of good work already there. But yeah, again, that investment in workforce I think is really key. That might be an officer or two, it might be training, but I think again, if there's any opportunities to resource that going forward, that would be great, because I think it's the kind of thing that really does need a bit of a push to get it going, and some dedicated resource. Thank you, Chair.
Okay, thanks, thanks, Anna. Councillor Woodruff, can you ask your question? Or
Yes, certainly. Thank you, Chair. It's just it's really just a comment rather than anything. Very interesting about the 20-minute neighbourhood areas. We love talking about our historic 7 towns, but if we're really going to get into it, there's quite big differences geographically and in population wise between those 7 towns. I mean, compare Ealing and Perivale, and I think it becomes a bit tricky. I've always I've not really been a great fan of this 7-town approach, because they're sort of vastly different between them, and it would be better to have a more even-handed approach throughout the borough. But it's just a comment rather than a question.
okay, thanks, thanks, Simon. Okay, and I can see Councillor Martin also wants to perhaps ask a question or make a comment, but okay, over to you, Dee.
Both, I suppose. So I was just wondering about timeframes and how we can keep everything up with other developments. So, for example, we know in Southall there's going to be a substantial increase in housing. Where are we with the planning for that in terms of the other services that we might need, such as health services, for example, and how much of a delay could there be for us to be able to provide those? And I'm just going back to what Sophie's doing. Obviously, we've been working on the business for Northolt for a while now, and it at least feels in that case that we're trying to get a bit ahead of the game on a lot of things, in that we're expecting quite a bit of change in Northolt, and we've sort of tried to do things before they happen rather than after they happen, and whether we might want to, I say, have a bit more maybe openness about some of the bigger plans that we have, or a way of sharing those that enables people to be more prepared for some of these big changes that will have an impact definitely on these sort of services. So mainly really just to get an idea of where we are with keeping up with some of the big developments, and if we are going to have issues for a while, for example in Southall, if we aren't up to date with where we should be on keeping up with healthcare, etc. in that area.
Okay, thanks, Dee. Okay, well, I'll give the panel a chance to respond to those points then, in the same order as before. So Polly first, then Nihad, then Sophie. So Polly.
Okay, so just on the timeframes question, so I'm aware in our analysis that there's quite a lot of extant development, i.e., a development which has been approved, which hasn't yet been built out yet. So my team doesn't actually have the data to be able to kind of say how much more development is going to take place and how much more healthcare infrastructure will be required based on what we've seen. But I think the Hoodoo model is a good indication of where it will be needed. So maybe there is a sort of exercise to be done to sort of look at those extant developments and kind of approved developments, and just kind of have a bit of a sense check of whether that's going to kind of change things significantly in terms of healthcare requirements, health infrastructure requirements. yes, a very good point. And I think, yeah, Sophie and kind of the work she's doing, I think would be really good to see how you could get ahead of the game and kind of look at those areas where there might be kind of you know, real kind of crunch points of housing need and healthcare need, how you could kind of address that in advance of it becoming a real issue.
Okay, thanks, thanks, Polly. So, Neha.
Yeah, thank you. So I'll just go on. You know, how prepared are we with the health provision? As I was describing, the north part of the borough, there is a pressure in our general practice, but it's not only estates, it's also workforce, it's all sorts of things. So we are that is what we are daily trying to address and come up with solutions and stay on top of. In Southall, we've been fortunate. So although the developments have been going up, we have had a couple of local GP practices who have had space and received funding from National Capital, either improvement grants or the ETTF funding. And we were able to, a few years ago, just before COVID, expand on those premises, and therefore they've been able to increase their capacity and take on the new residents moving in. So we've been fortunate, but this all of these things, you know, just like it does for a development, that it's planning over a number of years, and it's the same with healthcare provision. So I'm constantly looking at what's coming down the track and what we need to therefore consider, and that's not only from a development perspective, but also premises that may not survive very much longer, or their leases are coming up and the landlord wants to sell their premises. So I'm constantly, this is a constant cycle that we're on, and constantly looking at where we can grow or develop premises. So yeah, I hope that helps.
Okay, yes, thanks. Thanks, Sophie.
Yeah, I think in terms of timelines for the 20-minute neighbourhood frameworks, so those are already underway in Northolt, Greenford and Perivale, and Acton, although at sort of varying stages, and they're sort of all currently going through various forms of engagement and community consultation. But the plan is to have sort of drafts of those frameworks ready for Reg 18 consultation in the summer as part of the local plan evidence base. There certainly are ambitions to prepare frameworks for the other towns as well, subject to officer resource and funding. And I think, yeah, in terms of timescales, the idea is that these frameworks are very much preparing and looking forward. It's about planning for the next 15 years and beyond, as well as having some short-term, quick win projects as well that we can sort of make a short-term impact on. But it is a sort of very long-term sort of strategy, I suppose. So yeah, I think other than that, I don't really have anything else to add.
Okay, thanks, thanks, Sophie. Right, I can't see any more hands up. Is there anyone who wants to ask another question or to say something? Okay, people's questions seem to be exhausted. I've just got a quick point of my own to throw in recently, which is that, I think Polly was saying that she didn't get much information on developments that are sort of in the pipeline and how those would shape demand. So I think we should basically, there should be a way in which we can provide her with that information, and that could be fed into the, that could be fed into the into the plan. So it would take account of future demand as well as just the growth in demand that we already know about. And I was also thinking, I suppose, because the population of Ealing is likely to continue to grow. We've got targets for over 2,000 new dwellings a year. Obviously, those are going to have to go somewhere in the borough. There are going to be more of them going into some parts of the borough than others. So I wondered how we could feed all of that information, both of developments that we know have actually been approved, are in the pipeline, and also where we believe developments beyond that would take place, so we can kind of get a bit ahead of the game in planning health provision, rather than sort of trying to catch up. Now, I don't know if there's anyone from planning who's involved in the plan who'd like to say something about that. I don't know. I noticed Sam is here, but if he wants to say anything, and then perhaps...
Thanks, Councillor Conlon.
And go ahead.
Yeah, I mean, just to say, that's exactly the ultimate aim of this piece of work. So basically, we're at the stage currently of gathering, as you've heard from the speakers tonight, what's effectively, if you like, both our spatial model and our sort of current health baseline around the borough. So current level of provision, and also the type and effects that we see that spatial planning has on health outputs. The intention is ultimately, with the conclusion of this piece of work, and also then in line with all of the sort of spatial options that are forming other parts of the work that are being done in the plan, to bring that together precisely to achieve what you suggest of getting ahead of both where applications are going, what their needs are, and the broader spatial effects of planning on health, and thereby to embed the improvement of health across the plan. Now, that may or may not take the sort of approach that Polly was talking about, either of this explicitly health in all areas of council policy, or it may be something on which there's a more direct spatial effect. I think that's one of the things that we're seeking to establish through this. But you're quite right, that's very much where we hope to get at the end of the process once this research is complete.
Okay, thanks. Thanks, Sam. Okay, are there any of the speakers who want to add anything to that, or add in, or just add any sort of final thoughts on anything? Or okay, Neha, I could see your hand is up. Does that mean you want to say something?
Yeah, I suppose just a plea. When we're planning health provision, we are already very tight, so please just bear that in mind. And I'm hoping today's presentation gave you a bit of context, but it does take time to put services in place. So any information you can share as proactively as possible with health teams would be extremely valuable.
Okay, thanks, Neha. Yes, hopefully that has been taken on board. So the more the earlier that you hear about, plan new developments and start speaking to developers and so on about what sort of health provision can go in there, the better, really, I guess. So yeah, we do need to take that on board. Anyone else want to? Okay, Polly, is that something from you? I can see your hand up.
Yeah, hi. I just wanted to add to Sam's comment that yes, that's a sort of known unknown at the moment, that kind of integration of the kind of spatial options work stream, which another ARUP team are working on closely with Ealing Council planning team and regeneration teams. So yeah, just wanted to kind of emphasize that is a kind of known piece of work that needs to be done. Okay, so that bit of work is a known, as what was he
Donald
Yeah.
Rumsfeld was it would have said. Okay, and it should be being done. That's good. Okay, well, we're coming to the end of the meeting now. So unless I see anyone sort of shouting out or putting their hand up, okay. Yeah, it's just before 8 o'clock, so we're going to finish on time for a bit of a change. So thanks very much to all of the speakers, Polly and Neha and Sophie. So you've given us plenty to think about, and thanks for sort of answering our questions. I think you did mention that the Southwark new local plan was a good example. So I'll go and have a look at that, and I guess their planning officers are already aware of it. And if there's any good stuff in there that we can pinch, I'm sure, you know, we're allowed to do that. I don't think there are any laws against plagiarism in local plans, are there? So maybe we can do that. And otherwise, you know, that normally we should put in a pitch for the next meeting at the end of this meeting. But at the moment, there isn't a next meeting. There will be local elections soon. So there will no doubt be a next meeting after the elections. But who's going to be on the committee, who's going to be chairing it, and so on is all sort of quite up in the air. But maybe some members of the committee will be on the new committee. Some others obviously won't. But anyway, sort of best of luck for there will be meetings of the Local Development Planning Advisory Committee in the future after the elections. Wishes to all of the members who will be involved.
Chair, one thing I will seeing that it's appropriate to thank you for your chairing for this year, and it's all gone very smoothly, so congratulations.
Okay, well, it hasn't gone totally entirely smooth. There's been one or two glitches, but I think it has generally, yes, it has on the whole gone smoothly. So yes,
Can I second that?
Thanks for that, Simon. Yeah.
Can I just second that? I don't think we've got an opposition member here in an official capacity, but it's traditional for an opposition member to second a vote of thanks to the chair. So
okay.
Thank you very much for all you've done on this.
Councillor Sumner had to leave early. He did give his apologies. Okay, thanks, John. Okay, well, thanks very much for that then, and thanks again to the speakers. And that brings this evening's